So I am from the PACU and I'm giving you a report and you're receiving this patient to the surgical floor.
Okay.
It's Thursday at 13:30. I have for you Matthias Hedding. He's a 62-year-old male, diabetes type 2, heart failure, full code, allergic to iodine. Came in with a wound infection of his right foot and heel, and they went in and did a wound debridement in the OR. He's still a little drowsy, but he's pretty awake. Sorry. Blood pressure, he was a little hypertensive. He's afebrile. I have him on O2 liters just because. His pain was controlled in the PACU. He has half NS going at 100 mils an hour to a right forearm IV. I've given him a few ice chips. He did not have any nausea, vomiting. His lungs had some crackles bilaterally. His skin is intact except for the foot wounds. He just has a dry Curlex wrap on that right foot. He's kind of anxious. He's a little bit of a worrywart. Preoperatively, he was a standby assist. Lab work that was done yesterday. Significant findings of elevated white blood cell count, elevated SED rate, and an elevated hemoglobin A1C. He's single. He does not have a lot of support. He has a friend. His name is James. He just left for a little bit. Questions?
You said his pain level was controlled in PACU.
Mhm.
What was it at?
He's not having any pain.
No pain now. Okay.
Yeah.
Okay.
Yeah. It resolved.
Okay.
Okay?
What do I do?
We're doing them on YouTube. You just hang on to it.
Oh.
Okay?
Wait, this is gonna be on YouTube?
It's a secure link. Only
Oh
you'll
my
have the
goodness, it
access to
scared
it.
me for a second.
All right. You can also record it.
Okay. Hi Matthias, my name is Korrina. I'm going to be your nurse today.
Hello, I'm Rebekah. I'm gonna be your nurse also.
We're just going to check your ID band.
Okay, thank you.
And if you can just tell me your
Two
name.
things I forgot to mention to
Yes?
you. One, there's a 2-second delay on this recording.
Okay.
Turn it down.
It's just kind of making like a fluttering noise. It's kind of staticky.
So just pause for a second.
Okay. That was a little better.
I don't hear you anymore. Hang on.
Oh, we just heard you.
Okay, perfect.
Okay.
Are we
You
good?
guys say anything?
Yeah. Are we good? Can you guys see the wall? So.
Talking at all?
Now I am.
A little bit.
Can you hear us? Okay. I can hear you through the wall better.
Okay. Was there anything else, or are we good to go? I'm looking at this. I don't know
We're good to
why.
go.
Okay, cool. Okay.
Okay.
Name,
All right,
Rebekah.
can you tell me your name and date of birth, please?
Sure, it's Matthias Hedding, and my birthday is August 14th. I'm 52 years old.
Okay. How are you feeling right now, Matthias? Are you having any pain?
It hurts so much.
What? You said your leg hurts?
You're hurt. You're in a lot of pain?
It is, but when they did the surgery, it's awful. It hurts really bad.
Okay, on a scale from 0 to 10, 10 being the worst pain you've ever had, what would you rate it? A 9? Okay. Do you want to take his blood pressure and then we can go grab some meds?
Yeah, if you want, if you'd like, I can go grab the meds now. I
Okay.
can see if he's got any meds.
Okay.
Okay, I'm gonna go check and see if you have any medications ordered. Would you like to have a pillow underneath your head? Sit you up a little bit more?
Sure, that'd be great.
Okay. There's a pillow up there.
Okay.
And then maybe while I'm
Taller.
maybe while I'm getting the meds, if you want to
I'll get his vitals.
take a look, maybe see if there's
Check his
positioning and stuff. I'm just gonna sit you up a little bit. We're gonna put the pillow underneath your head.
Oh, this is on. Hold on one second. Let me fix your nasal cannula because this is not right. Okay.
Okay.
Must
Okay, thank you.
not be very comfortable.
There we go.
There we go.
All right, I'm just gonna lift your head up a little bit. All right.
Oh.
How's that?
Okay, I'm gonna go check the meds.
Yeah, but my foot, it just hurts so bad, you guys.
Okay.
It hurts so bad. So
Just take a quick peek just to make sure there's nothing.
we're just gonna check your surgical wounds really quickly, and then we're gonna go grab you some pain meds. Okay?
That would be great, but it's my other leg.
Right.
All right. Yeah. You got that one? Okay. I'll go check and see what we got in the
I don't
orders
see
for him.
any drainage or anything.
Careful.
What did she say?
Be careful, I think.
Okay. We're not touching your leg quite yet. We're gonna get you some pain meds. But before I want to take his vitals, but we're not gonna do that until we get the pain meds because his blood pressure is gonna be super high.
Hey, just to keep bringing me.
Huh? Did you hear that?
I
Just
can,
to keep bringing me.
What medication is she bringing you? She's gonna go and check your medications. I think I saw an order for morphine.
morphine 2 milligrams.
Morphine,
IV.
2 milligrams
Okay.
IV. So that's.
I'm not sure I want that. I'm really worried about becoming addicted.
You're worried about becoming addictive?
Well, with the pain that you're having right now, it's more important to control your pain level. And just by being on it for a short period of time, you don't really have that high of a chance of becoming addicted to it. Okay?
I had a really good friend who had surgery, and he became addicted to it.
If you're on the medication for a longer period of time, it does increase your chances. But in order for you to heal and get better, we've got to get you out of pain.
Okay.
Would you like to
Well,
try?
then maybe we should get it, because it's really hurts.
Okay, I'll go and get that for you.
Okay. So while she's going to get your pain meds, I'm just going to check, because we already checked your wound, I'm just going to listen to your lungs, okay? Just
Okay,
take a
can you
deep breath.
Yes, or do I have to lay flat?
What did she say?
I don't know. What was
What
that?
is it?
Can you help me sit up, or do I have to lay flat?
Oh. I'm gonna put you up a little bit, okay? Oops. So you want to sit up a little bit? I'm gonna sit you up and then just tell me when to stop, okay? Is that okay, or you want to sit up a little bit more? Did she hear me?
Is your is the bed okay like that, or did you want to sit up some more?
Oh, no.
That's okay. It just hurts so bad.
Okay, she's working on getting you the pain meds, okay? She'll be back in just a little bit.
Okay.
I'm gonna have you take some deep breaths for me, okay?
Okay.
Okay. Take another deep breath. I'm gonna kind of expose you here for a second, okay? Another deep breath. Okay, I'm gonna crackles. I'm gonna come on the other side, okay? Expose you a little bit.
Yeah,
Okay,
okay.
deep breath.
I think she said that's good.
Okay, so I do hear crackles in the lower bases. And I'm just going to listen to your heart, okay? under here. The apical. Perfect. Okay.
How does it sound?
I can hear S1 and S2, but I do hear crackles in both lower lobes bilaterally. Is that right?
I don't know what that means.
Oh, the patient's asking how does
Sorry, I thought that she was asking about it. So, I do hear some crackles in your lungs, which means that there might be some fluid. I mean, it's common, after surgery that will happen. So, after we get you some pain meds and everything, I'm just going to work with you with the incentive spirometer. I don't know if they talked about this preoperatively, but we have a little device over here called an incentive spirometer, and it's to help expand your lungs, and also sitting you up will actually help kind of make you take deep breaths, and this will actually help prevent pneumonia. And there's little sacs at the bottom of your lungs that this will help open up those sacs. So after I know you're in a lot of pain right now, so we'll go over this after we get you some pain meds, okay?
Okay, is there anything we can do for my foot while I'm waiting for my pain meds? Because it really hurts.
Maybe
For your foot? I don't want to put ice on it, but do you want me to see if I can elevate your legs a little bit more? Because there's already...
Maybe, yeah. Maybe can we take the covers off? Because I don't like them rubbing on my toes.
Of course. Let's see. Sorry, I'm trying not to move your legs here. Where is this sheet?
Alright, so I got the pain medication here for you.
Okay, I'm just going to take this off of your leg here.
Just gonna scan your arm. And again, if you can just tell me your name and date of birth.
Hedding.
Okay.
That's a little better.
That's a little better. Do you want me to put some pillows underneath your feet? Kind of like elevate your heels a little bit? That might help.
Please stand up.
Did she say yes?
It's hard to hear.
Did you say yes to that?
Scan this again.
I can't hear you.
Yes, thank you.
Okay. I'm going to come right behind you. Sorry.
No worries.
Okay, I'm gonna move your foot slowly.
Be careful.
Of course, I will be careful. I'm just gonna move it just a little bit, okay, to put a pillow underneath.
Okay, thank you.
Perfect. So also, this will help.
Like a hot pack on it or something?
Can we do hot pack?
Do what?
Hot pack?
He just had
Surgery.
And will you straighten out my foot?
Yes.
I don't know that we want to put hot pack on it yet.
Okay, there we go. I'm going to do it to the other foot too. This will also help because you're going to be laying in bed. This will also help keep pressure off of your other heel as well, that one that doesn't have a wound on it, okay? Are you able to move your toes for me? Perfect. Okay, I'm just going to check to make sure you have pulses down here, okay? Let me know if I hurt you at any time and I'll stop. I feel like there's
Pulses?
Yep. Okay. And I'm just going to have you grab my hands for me. Okay. And I'm just going to check your pulses up here as well. Okay. Seems like they're both pulses are 2+ bilaterally. I've got some strong pulses. Huh? Well, you're not here, she said.
Can I pause this?
Do the change.
I need to pause this while I give him the meds. I don't want to give him more.
Review.
What's with my ID?
Nothing's wrong with it. I'm just going to pause it so I can give you your pain medication.
Can we just?
It's paused.
Oh, okay.
It is okay.
How long is that going to take to work? Is it going to get rid of my pain fast?
It should work within a minute or two. It works pretty quickly. I do have to give you the pain medication over about 2 minutes, but then after that it should start to work pretty quickly. And you may be a little bit drowsy afterwards. You may be a little bit tired, a little bit of dizziness. You let me know if you feel anything like that, okay?
Are they talking?
I didn't hear. What was that?
I think I'll like that, being drowsy.
Yeah, especially if you're in a lot of pain right now.
So while she's giving you some pain meds, what do you do? Are you really good at controlling your glucose at home? Are we allowed to do finger sticks? Like, can I just say I did a finger stick? I don't know.
I don't know.
Is this supposed to be on him? I'm so
Did you ask me about my glucose?
Yes.
Got it. I check it maybe twice a day. I don't like to poke my fingers.
So are you poking your fingers like in the middle of your finger, or are you poking it on the side of your finger?
On the side of my finger, but it still hurts.
It does hurt, but you want to make sure that you can rotate fingers and make sure that you don't use one finger all the time, because it can kind of get calloused over and harden up, and it'll make it more painful if you do that. But as long as you're sticking to the sides of your fingers when you're doing it, it's just to make sure you're monitoring your glucose, because you do have diabetes. You want to make sure that like with your diet, you want to make sure that you're not eating too much sugar, and you also want to make sure that you're checking that, so if you need insulin, you can take the insulin, okay? This is not good.
Yeah, I don't need a lot of sugar, but I eat out all the time. I don't cook.
You do eat out all the time? Well, a lot of fast foods do have a lot of sugar and artificial flavoring in them, and that can also contribute to your symptoms being worse.
And there's a lot of carbohydrates in them, which can break down into simple sugars, which can elevate your
Like, have that for lunch later.
Like probably eating McDonald's. I would do it in moderation, not eating out all the time, but, maybe make it a day of like once a week to go out, and then make sure that you're at home making dinners, or they actually have some really awesome places that will deliver meals to you, like Meals on Wheels, and it actually is pretty healthy food, and then you can just have to whip it up. It's already made for you. How's
It's a good option for me.
Huh?
Could be a good option for me.
Yeah, I know quite a few people who've done it, and they really like the meals, so. Okay.
So how are you feeling right
Thank
now?
you. I'll look into that. Will the case manager help me find out if I apply?
Yeah, we can talk to the case manager about maybe looking up some websites, or I can actually even go out and do some research for you on the computer and bring you back some sources. How are you?
Thank you.
How are you feeling right now with your pain and your legs being elevated?
The leg's still good. Can I just close my eyes and wait for that pain medicine to kick in?
Of course.
Well, it should be starting to feel a little bit better now. We've got the pain medication in there. Is it starting to feel a little bit relieved?
Maybe. I'm going to close my eyes and rest, if that's okay.
Well, we'd like to have you talk with us a little bit more. We just want to see how you're reacting to the medication. So we'll be in just a few more minutes just to make sure you're reacting okay. We don't want you to go to sleep just yet, okay? Did you already do?
See you later.
What's that?
Good.
Are we good?
Thank you, and we're all good.
Oh.
Oh.